Welcome back to the channel. My name is Thomas Fletcher and I'm the host of the LCSW network. If you're new to the channel, please do me a favor by smashing that like button, by subscribing to the channel, and by sharing this video with your social work colleagues and friends. The purpose of this channel is to create a community of hope and support where social workers can come together for relevant news, information, and inspiration. Okay, just my standard disclaimer that this video is not being sponsored, endorsed, or promoted by any government agency, and that the opinions and views stated in this video are mine alone. Okay, so today I wanted to talk about another VA social work position, one that's called the Local Recovery Coordinator. Given that I've worked as an LRC for over 9 years now, I like to think that I have some knowledge and insight about this position. So this is a nationally mandated position that is located in every VA medical center and several larger VA community-based outpatient clinics across the country. This position was created by VA Central Office back in 2007 to implement a nationwide push for recovery-oriented care in VA mental health programs. As of December 17th, USAJOBS is listing 29 positions related to the LRC positions. Just as I've done in previous videos highlighting HUD-VASH and suicide prevention coordinator positions in the VA, in this video I will bring awareness to several LRC jobs currently listed in USAJOBS. The first LRC job that I will be talking about is a GS-12 senior social work position in Lebanon, Pennsylvania. The closing date for this application is December 29th. So let's review the summary. The Local Recovery Coordinator is located in the Behavioral Health and Sciences Care Line and serves to assist in implementation and policies and procedures from the National Recovery Coordinator, and to facilitate implementation of recovery-oriented services in mental health programming, including education of providers, veterans, and their families on recovery and evaluation of implementation efforts. The LRC functions as a champion and advocate of the recovery model. The LRC also serves as a recovery ombudsman to the Associate Chief of Staff for Behavioral Health and Sciences, program managers, and staff on recovery and implementation of recovery-oriented services. The requirements for this position and most VA and other federal agencies is U.S. citizenship, selective service registration for males born after 1959, background security check, and proficiency in written and spoken English. The qualifications for this position are an MSW from a school of social work that is fully accredited by the CSWE. I did another video about the CSWE and why it is important, so check that out. So again, you need to have a MSW from a fully accredited CSWE school, and you must have an LCSW from any state. There are 5 KSAs, or knowledge, skills, and abilities, that you will have to address in your application. I will leave a link for this job position in the description below. Okay. There are other GS-12 LRC positions available, but the next LRC-related position that I want to highlight and discuss is a GS-13 Supervisory social work position in Wichita, Kansas. The closing date for this position is December 24th, 2020. So let's review the summary for this position. The social work supervisor for the recovery-based programs has full authority and responsibility for providing programmatic, clinical, administrative, and supervisory support to social workers assigned to multiple recovery-based programs to include substance use disorders, suicide prevention, mental health intensive case management, local recovery coordinator, and substance abuse residential rehabilitation treatment facility. The requirements and qualifications for the GS-13 position in Wichita, Kansas are almost identical to the ones for the GS-12 position in Lebanon, Pennsylvania. You will need at least 1 year of experience at the GS-12 level to qualify for the GS-13 position. There are 6 KSAs listed in the GS-13 position. I will leave a link for the GS-13 position in the description below. Okay, so now for my editorial. I love being an LRC because I get to practice at both the micro level and macro levels as a social worker. I get to facilitate recovery groups for veterans with serious mental illnesses and substance use disorders across many programs in the mental health department. I also have the opportunity to provide trainings to social workers, psychologists, psychiatrists, nurses, and peer support specialists on providing recovery-oriented mental health care. I also get to work on a nationwide initiative to re-engage veterans with serious mental illnesses who have fallen out of care from the VA. On any given day, I'm also providing consultations to various mental health providers who are working with veterans with complex psychosocial situations. I've also been responsible for overseeing our mental health summits, which we provide, where we provide education and outreach to veterans, their family members, and our community partners. In addition to these summits, I also participate in our annual open houses and our quarterly town halls, where administration talks to veterans and provide information about updates and developments that continue to happen in the VA. I've also participated in many surveys and reaccreditation inspections from CARF and from the Joint Commission, as well as internal VA surveys such as our quarterly mental health environment of care surveys. One of the best aspects that I enjoy about being an LRC, though, is providing field instruction, supervision, and mentoring to our MSW interns. I've had the privilege now of supervising interns for the last 4 years, and I love it. They inspire me to bring my best every day. So that's probably the best part of my job as an LRC is working with the next generation of social workers. Okay. So in conclusion, it really is a great job where I get to be creative, collaborative, and clinical. Okay, so let me know your thoughts about this topic and the video. Drop me some comments. Let me know what you think. I want to thank you for watching this video, and thank you for all that you do for your clients, for your agency, and for the profession. Please continue to support each other and yourselves. Bye for now.